For more on this tonight, we go to concierge physician Dr. Abe Malkin, joining us this evening from Los Angeles. Dr. Malkin, appreciate your time tonight. I'm sure there's millions of Americans across the country wondering, well, I got a flu shot. Isn't it going to work? What about that?
Good. Thanks, Ed. Good question. So to better understand why the flu shot hasn't been as effective this year, it's better to understand there's various strains of the flu. And as you mentioned in your intro, the H3N2 strain is particularly ineffective with the vaccine. We've been seeing in the southern hemisphere about 30% effectiveness in that vaccine, similar to what we saw last year. You know, in the past, some of the strains of the flu, such as H1N1 or influenza B, the vaccine has been more effective. But this year, we're unfortunately looking at about a 30% effective rate of the vaccine.
And how severe is this flu this year as opposed to other viruses?
Yeah, so typically what happens with the flu is, like you mentioned in your intro, your body can fight the infection given that it's a virus. But what we're seeing this year is quite a few bacterial secondary infections that are complicating the flu. Things such as ear infections, pneumonia, or other respiratory infections that cause people to have to be hospitalized for the flu.
Prevention. What do people do?
So you mentioned it before, the most important thing is to get the flu shot. Even if the flu shot isn't effective in preventing the flu, it's still helpful for managing the symptoms, so decreasing the severity. So that's number one. Number two is reduce the spread of the virus. The virus is spread through respiratory droplets. When you cough or sneeze, you can spread it to others around you. So wearing a mask, if you're having severe coughing and you need to be at work or around others who might be affected, try to wash your hands as much as possible to help prevent the spread of the disease. And then third thing is, make sure your immune system is really up to health. Make sure you're getting 8 hours of sleep a night. Make sure you're taking supplements such as vitamins, vitamin C, B12, zinc, other supplements that can help your immune system.
And the H3N2, would people have the flu longer than maybe in previous years? Would it last a week or 10 days? How would this play out?
Good question. Typically we see the flu lasting 3 to 5 days at its worst, but this year we're seeing symptoms 5 to 7 days or even as long as 10 days. So I recommend for people to really stay on their over-the-counter medicines that they're using, their decongestants, other immune-boosting elements to really help prevent them from experiencing those severe complications of the flu.
And Dr. Malkin, is there any demographic that is more susceptible to the flu with this new strain of H3N2 as opposed to others?
Certainly. So individuals, children under the age of 5 and elderly patients older than 65 are more at risk of contracting the flu and developing complications. For the rest of the population, again, your body can fight the infection, but at those two at-risk populations, it's most critical to prevent the spread of the flu.
So sleep, vitamins, no stress, good diet, I mean, just be as good to your body as you possibly can, it sounds like, is the best defense.
Sure, and if you do end up getting the flu, there are medications such as Tamiflu. As long as you catch the symptoms within the first 48 hours, Tamiflu can be helpful for reducing the duration of symptoms by 1 to 2 days. So it can be helpful if you catch the symptoms within the first 48 hours.
And Dr.
if you are
and excuse me, but before we go here, I just want to ask you, how long do you think, is this flu season, normally it goes to the end of February. I mean, could this go longer this year? Could this be much more severe in numbers?
I think given what we've been seeing on the early phases, we can expect similar to last year, where the flu season may extend up until March, actually, this year. I wouldn't be surprised.
Dr. Abe Malkin, I appreciate your time tonight. Thanks so much.
Thank you.